In this presentation, we will have a discussion of the recent changes and their impact on the roles and responsibilities of a registered nurse, a discussion of the roles of the Nursing and Midwifery Council in relation to nursing practices, an analysis of the implication of the code on nurses' practices, an explanation of the need for effective communication in a multidisciplinary healthcare setting, an evaluation of the effectiveness of a multidisciplinary setting in approach to a healthcare setting. Registered nurses have a broad range of roles and responsibilities that are governed by law, ethical principles, and professional standards. The NMC Code establishes the standards that nurses must adhere to in order to practice in the United Kingdom. All health professionals, including registered nurses, are required to provide specific effective health service by their regulatory bodies. Health professionals receive specialized education to ensure they possess the necessary competence, skill, knowledge, and expertise for their chosen occupation. Teasdale recognised significant changes in the NHS finance and management since the UK Parliament integrated the White Paper Working for Patients 1989 into the 1980 NHS and Community Care Act. This has had a profound effect on both professional and patients' roles in healthcare. As a result, nurses are given increased responsibilities for health service cost management and resource allocation. According to Teasdale, the adjustments were made to improve hospital and primary care services by instituting a competitive internal market to increase efficiency and effectiveness. Harrison and McDonnell argue that during the previous 2 decades, political shifts have undermined the autonomy of nurses and other frontline clinics. For example, clinical guidelines have standardized care and weakened the authority of health practitioners over expert knowledge and abilities. In 2011, the government capped NHS compensation increase at 1%, affecting nurse retention and recruiting. On 10 October 2017, following a RCN campaign to scrap the cap, the Health Secretary said the cap had been removed. In April 2020, the government promised to pay off approximately $13 billion in NHS debt. Having minimal debt allowed trusts to grow infrastructure, staff, and technology while safeguarding assets through COVID-19. The aging population and rising costs of caring for the vulnerable and chronically ill are driving social changes in healthcare. Social changes has promoted new approaches to care such as clinical care pathways. Inequality in care has influenced service delivery, notably in areas of poverty. The Healthy Child program uses school nursing teams and integrated services to help improve children's health in 2014. Nurses today are expected to be much more technologically adept than nurses 50 years ago. Technology can be viewed as both a good and a bad thing because nurses must not only give essential and skilled care, but also learn how to operate a variety of specialized pieces of equipment. A computer is the most frequently used piece of technology by a nurse daily. Nurses use them to record the care provided to a patient. While modern technology is a massive benefit to healthcare, it does have its drawbacks, such as the high cost of training new staff, but it also has the potential to save lives. Beginning with the 1990 NHS and Community Care Act, which empowered nurses to control finances, this gave NHS hospitals community trusts the ability to self-manage. In 2003, the government included 60 additional pharmaceuticals to the nurses' prescribed formulary, including diabetes and asthma treatments, introduced in 2002. Following the Health and Social Care Act, clinical commissioning groups replaced primary care trusts in 2013. As a direct result of these consequences and developments in health policies and delivery, different new roles and career paths have opened in nursing. Advanced nurse practitioners, modern matrons, and specialized practitioners are highly skilled and knowledgeable nurses. Nurse practitioners expand their scope of practice beyond their initial licensure and earn additional credentials to teach certain medical conditions without direct supervision of a physician. Nurses are held accountable for their actions by patients, co-workers, and care outcomes. A good nurse can problem solve, reflect, plan care, and promote safety. A registered nurse prioritizes and supports people's needs and choices. The NMC serves as a professional organization for nurses, establishing standards for practice and behavior. The code serves to keep nurse practitioners, nursing associates, and midwives registered with the NMC accountable for their conduct, particularly when such actions don't meet their professional standards. The NMC protects the public and sets standards for nursing education, practice, and performance. For example, the NMC ensures nurse skills and knowledge are up to date. The NMC's operational structure is established under the Health Act 1999. In addition to the Privy Council, the NMC is audited by the Professional Standards Authority. The National Nursing and Midwifery Council approves and regulates courses and institutions for nurses and midwives. It investigates nurse claims, and addresses complaints and suggestions. A panel of experts decides a nurse's fitness to practice. The NMC may issue caution, impose conditions of practice, suspend or revoke orders. The code establishes professional standards for registered nurses. The standards are founded on patient and public expectations, as well as non-negotiable ideas and principles. The NMC will take action against a nurse who violates these criteria. Nurses are responsible for ensuring the safety of others. A nurse should act immediately when accidents or injuries occur. An apology should be extended immediately to the individuals who has been harmed, and any problems that have occurred must be corrected. Similarly, if an emergency happens, a nurse should immediately organize for an assessment and give care. Nurses provide patients with correct information, answer questions, and ensure understanding, and acquire both written and verbal consent. Consent can be obtained with the patient's cooperation and by building trust. Nurses and doctors must protect patients' privacy. Moreover, information disclosure is only justified to support direct care, to protect the patient or others, or in very exceptional circumstances. The code emphasizes the importance of maintaining a professional demeanor at all times. To conclude, nurses are accountable for ensuring that high standards of safe treatment are maintained. Failure to adhere to the NMC code may result in nurses being disciplined or prosecuted by other regulatory bodies if patients are harmed in any way. Effective communication skills may include active listening, verbal communication, trust, personal connection, cultural awareness, and presentation skills. Within the multidisciplinary team, the nurse should serve as a role model for compassion and effective communication. According to the NMC code, nurses are required to treat patients with respect and kindness, and to respond compassionately to people who are anxious. Working in a multidisciplinary team allows nurses to show compassion whilst providing quality treatment. Nurses must obtain formal consent and explain how personal data will be handled. Nurses are required to record information and understood consent, as well as to inform individuals about how their personal data may be used. Sharing of information is permitted only within the bounds of the law, as defined under the NMC Code Section 5. Additionally, nurses must take into account both verbal as well as non-verbal forms of communication, such as body language, voice tone, and facial expression. These are critical for patient safety, interacting with family members, and also interaction with other staff members. Bloomfield and Pegram believe that nursing is ultimately about empathy. Every nurse should care for patients in their most private moments. Compassion and respect help build trust and safety, while honoring the patient's unique values, beliefs, needs, and rights. Compassion is also a measurable sign of high-quality care. Multidisciplinary teams benefit patients' outcomes in numerous ways. For instance, professional knowledge can be shared and fertilized through cross-fertilization. This synergy of specialized skills and professional knowledge all contribute to the patient's holistic needs. Healthcare settings necessitate the collaboration of numerous care and medical disciplines. It is critical for communication to be at their best between all staff members. Without it, the team may not collaborate well together and may fail to meet the patient's needs. Effective collaboration within a multidisciplinary setting begins with an agreed upon method in which everyone operates in their own field of expertise. All involved staff members must be committed to teamwork and mutual respect. There must be a defined goal and a mechanism for tracking progress towards. Therefore, the team needs a coordinator to oversee the patient's treatment. Utilizing a multidisciplinary approach is beneficial as it increases opportunities for communication and interaction with other professionals, as well as continuity of care, instills confidence in patients and improves care. Charlotte Kratz defines nursing as a systematic method of providing care. Virginia Henderson described health and self-care capacity impacted by age, culture, and physical, emotional, and cognitive abilities. Her holistic nursing concept is built on doing, supporting, and working with individuals to regain independence. Critics of Henderson claim that her reductionist approach to nursing is ineffective, as people are much more than the sum of their parts. People create patterns of behavior in their settings, but Henderson failed to connect each component, resulting in a medicalized and simple model. Inadequate time for reflective clinical management, team development, and team building might result from poor communication in a multidisciplinary setting. Changes in the team makeup and staff might impact the outcome of the patient, and defining team boundaries can be difficult in a multidisciplinary setting. To conclude, multidisciplinary setting overall can lead to a better outcome for a patient. Nurses interact with other health and social care providers to fulfill their requirements of individuals with diverse conditions and circumstances. Patients are at the center of multidisciplinary care, and success requires collaboration. Practitioners must be aware of their roles and obligations, as well as their professional rules of conduct and practice scope.